evening. How you doing? Hi, my name is Violette. I'm going to be the nurse and we're going to go ahead and do the assessment. Can you please verify your name for me and your birthday?
Angela Smith, 3rd, 2550.
Okay, alrighty. Well, as per our conversation earlier today, I'm doing this assessment as part of my class requirement for graduation. Okay, and I thank you for agreeing to do the assessment with me, okay? And I'm going to go ahead and wash my hands and I'll be right back, okay? So, looking at you, I see that you are awake and you're alert. Do you know what day is today?
It is Thursday.
It's Thursday. And do you know where you are? Winnie Palmer Hospital. Okay, thank you very much. So we're gonna go ahead and start the assessment, okay? So I'm gonna go ahead and go look at your hair, and I see your hair is nicely distributed. Your face is round, your nose is proportioned to your face, and your hair is very shiny. And then I can try to feel for any lumps, any bumps, and I found none. Okay? And can you lift your shoulders up for me? Very good, very good. And then push, lift again. Okay, so both her shoulders are, when she lifts them up, they are symmetrical to her neck. And looking at her skin is nicely dry to touch. It's warm. There's no coolness to it, and it's good turgor, well hydrated. Very good. You did a good job. And there is no loose skin. So as per our conversation earlier, so I did check your vital signs. Your blood pressure was good, 120/60. That is within normal limits. Your respiration was 16, and then your pulse was 72. So these are normal findings. Do you take any medication?
Just some vitamins.
Just some vitamins you take daily. Okay. So no history, no medical history, no past surgical history. So without looking at your skin, taking your clothes off, do you have any scars anywhere in your body?
No.
Any tattoos?
No.
Okay, thank you. I'm going to go ahead and listen to your heart, okay? All right. So I'm going to go ahead just a little bit there. I'm going to look at you. I know you don't want me to look too much. I'm going to look at your, can I do this a little bit? Okay. Well, just visualize your chest wall, okay? Okay. So I don't see any masses, and I don't see any lump. The skin is, in her chest is nice and warm, and then no wetness. Okay, I'm going to go ahead and listen to your heart, okay? All right. Listen, Miss Angela. So when I put my heart like this, okay? So we have what we call S1, which is the dub, and then S2, which is the lobe of the heart. So when you hear that dub, like a horse tapping, that's the actual heart sound. So we'll start the first one. Take a deep breath. And then. So while I'm here, I'm gonna go ahead and feel for your epical pulse, okay? Very good. So I don't feel any bump, any lumps, and there's no resonance there. Can you see that for me just a little bit, please? Thank you. Yeah, I don't think no sign of resonance anywhere. And so while I'm here, since I have you up, I'm gonna go ahead and listen to your lungs, okay?
No problem.
Take a deep breath for me. Deep breath. And again. So what I'm listening to Miss Angela. I'm looking for any abnormalities. I didn't hear any abnormalities at all. Your lungs are clear. Okay. Deep breath again. And again. Okay. So your lungs are clear bilateral, meaning no history of asthma or anything. Okay. So clear lungs, that's a good sign, okay? So I didn't hear any extra sound when I listened to your heart, so there's no murmur for me to say you to go see your cardiologist, which you don't have anyway, okay? So this is a good finding. All right, so again, we're gonna inspect your chest area, that's your lungs, okay? What I'm gonna do, I'm gonna just palpate first, okay? So I just palpate, okay? Go ahead and take a deep breath for me and relax. Okay. So I can see Miss Angela's chest rises significantly. There is no difference in location, and it's symmetrical. Take another deep breath for me. Okay. All right. So I'm going to go ahead and do some lower palpation. Okay. Okay. So I'm going to do something what they call testing for tactile firmities. So when I touch the back of your lungs, go ahead and say 99 for me, okay? Sit up for me a little bit. So say 99.
99.
Okay. No resonance. 99.
99.
99. Very good, very good, very good. So far everything is going well.
Thank you.
Okay? So go ahead and lay down for me. Yeah, she's a funny lady. Alrighty. So what I'm gonna do what they call percussion. So this part is very hard for most nurses to do it properly, but I've been reading about it a little bit, so I think I'm gonna do very well on this one, okay? So what I'm gonna do, I'm gonna put my hands, okay, over your chest, and I'm gonna tap, okay? And you're gonna hear, as I go upper, you're gonna hear the sounds dulling a little bit, okay? Okay. Okay. So far, I got this far. You're very healthy.
Thank you.
I'm glad I picked you. Alrighty. So we're gonna go down to the abdomen, okay? Alrighty. So we're gonna bypass the abdomen. We're gonna go do what they call a vascular assessment, because the abdomen is the very last one. So in the abdomen, I'm going to check for your jugular, so your carotid. So those two, I'm going to do it one by one. Because you know your carotid is the big vein, okay, and your jugular, you know about the jugular vein? What about the jugular vein that you know? That's right. Okay, so I'm just going to feel for any lumps, any bumps, okay, any abnormalities. Let's say if it was like pulsating, that wouldn't be good, okay? Okay? Alrighty. Let me check the other side. Okay. Does it hurt when I do that? Okay, very good. Let me go ahead and look at your thigh, where am I at? Okay. So I don't feel any lumps, any bumps, and no abnormalities for me to be worried about. Alrighty? Okay. While I'm at it, I'm just going ahead and so even though we did the vital signs already, I want to, for the purpose of the video, I'm going to check your pulse, okay? So right over here is your brachial pulse, okay? I'm going to listen to it, and I'm going to go on the other side, okay? Good. And I'm going to check your radial pulse. Very good. And then over here. They're nice and even, okay? And I'm going to go down on your feet. And I'm going to check your, what they call a dorsal, it's the top of your feet, dorsal, okay? Do you mind if I take your socks off?
No problem.
Okay. I'm going to take both of them off. I need to make sure both of them are even. Okay? So, very good. Positive pulse. Positive pulse. Okay, over here is a positive pulse. Okay? And then we're on the other side, it's what we call the tibial, the posterior tibial pulse, okay? So all pulses are very present. And again, when I'm on here, I'm just going to look at your toes, okay? So I see no clubbing, okay, of your toes. Okay. Can you push my hands? Just push, but I will push you the gas, okay? If I could just lift. Lift my hand. All right. So I'm testing for strength, okay, in your legs. Do you run? Do you do a lot of exercises?
Well, I work in environment, I have a lot of exercising.
That's nothing exciting, right? Okay. So I'm going to go ahead now and check your abdomen, okay? All right, so we'll lift it. All righty. So again, you didn't want me to lift your clothes, so I'm going to have to do what they call a little palpation, okay? All righty. But when I touch, please tell me if it's tender. Is it tender, your abdomen? No? Is it tender? No? Okay. When does get a bowel movement? Every day. Okay. Alrighty. Is it still non-tender? Non-tender. Okay. So I'm going to go ahead and for the purpose of testing to see if you have any liver or spleen abnormality, I'm going to do the deeper palpation, okay? So I'm going to put a little bit. Does that hurt when I push?
No.
Okay. And does that hurt when I push?
No.
No, okay. And I'm going to go ahead and listen for vowel sounds. All for that, you have 4 quadrants, open and lower, okay, okay? Alright. Alright. Vowel sounds are active. Okay. Lower. Your belly is hungry. Okay. So that's very good. Okay. So the same thing with the chest when we're focusing. I'm going to do the same thing in your tummy, okay? I'm going to put my hand and I'm going to tap, okay? Okay. So I don't feel any abnormality. I don't feel any bumps, any lumps. I don't feel any rigidity in the abdomen when I palpate, and no tenderness. And the last thing we're going to do, Miss Angela, we're going to sit you up again, and I'm going to do the same thing in your lower back, okay? So what I'm going to do is mainly to test to see if you have any issue with your kidneys, okay? It's in your lower part of your back, and I'm going to do the same thing I did before, okay? I'm going to focus, okay? See the same thing you hear that noise? Yeah. Okay. Do you feel, is any painful?
No.
Okay. Discomfort when I push down? Okay. Do you have empty your bladder regularly? You have any issue peeing?
No.
Any UTIs? No? Okay. Alrighty. So I think that we can conclude that your assessment is negative, but I'm going to do one more thing before we go, okay? I have my cotton swab without you looking, okay? Don't be funny. Okay. Without you looking, I'm going to use my cotton swab, okay? And you're going to tell me 2 things. Do not look. Is it soft? Okay, you want to tell me soft? Yes? And then is it soft? You sure? Soft? Soft.
Yes, it's soft.
So when I poke you with the cotton swab, is it soft?
Right.
Okay, when I poke you with this, is it soft?
No, that pinch it.
Very good. That's what I wanted to hear. So what I was checking to see for sensation of your lower extremities, okay? Alrighty. So if there was any abnormal finding in your assessment, I will refer you to a primary doctor. But as for me, I think you're very healthy, and I thank you for letting me do the assessment on you, okay? Thank you very much.